The psycho-emotional intervention with parents of very preterm babies during the first year, a single-arm pilot study, has been developed by Dr. Padilla-Muñoz, Barbancho-Morant, Lanzarote-Fernández, Sanduvete-Chaves, and Chacón-Moscoso. This study has been supported by the Ministry of Health of Andalusian regional government in Spain, and we would like to thank the participation of all the families and the professionals from Hospital Universitario Virgen del Rocío. Studies of intervention programs that aim to improve the emotional state of parents of children admitted in the neonatal intensive care units are not very frequent in Spain. Also, it is rare to find the study of risk factors that compete with protective factors associated with the birth of these child. And one of the most important limitations in this study is also the participation of fathers that we have used and we have encountered in this study. So the emotional experience of parents can influence each other and the attachment processes. In this context, the objective of these studies is to study the emotional profile of fathers and mothers during preteens and study the relationship between parents' emotional profiles and babies' clinical variables. Also, the comparison of parents' emotional profile before and after the psychological program that lasted 12 months. After a serious and rigorous process of selection, the final sample was composed with 50 couples, 52 parents, families, with mother and father. And the instrument we used to study the degree of resilience, the symptom of depression, and all the associated variables, and the post-traumatic stress disorders. Also, the clinical variables of the premature baby. Basically, the psycho-emotional intervention program had three main stages. The first stage with 3 sessions were focused on first emotion and care. In a second stage with 4 sessions, optimizing and development and upbringing. And the third stage with 4 sessions, the care routine and family organization. The main result, we can see that there is a relationship between post-traumatic stress disorders and subjective clinical symptoms, as much as the degree of resilience between mother and father in relation to mother state depression total and father state depression total. We found that there is a statistical relationship that is significant between the post-stress disorder plus the subjective clinical symptom in mothers in relation to the mother state depression total, and also there is a significant relationship between this state depression total between father and mother. In a second place, we found that there is a statistical relationship between the post-traumatic stress disorders plus the subjective clinical symptom in a pre-measure and in the post-measure in mothers, and a relationship between the father degree of resilience in the total post. All of them are statistically related with the mother state depression total, and the mother state depression total in the post-test is related with the same measure in the fathers. The main implication for families and health professionals is that take into account that mother and fathers may express and cope differently with the admission of a preterm baby. Of this situation. Mother seems to be more emotionally impacted by the birth of the baby, and fathers show fewer symptoms in both of times. So we recommend a specific intervention to include risk and protective factors, and this program should seek more active involvement of care of this infant, and considering the training of health professionals. So we would like to thank you very much for your attention.